Welcome back. Organization Partners Health Plan will launch a mobile dental clinic in the Bronx on February 18th. This comes as an effort to solve disparities amongst patients with intellectual and developmental disabilities. Joining me to discuss the first mobile dental clinic for PHP members is Chief of Member Relations and Advocacy, Karleen Haines. Karleen, thank you so much for joining me.
Hi, Kibin. Thanks for having us.
Now, could you first talk about your organization Partners Health Plan?
Sure. So very unique health plan, a managed care plan, but very different from others in that we only serve the DD population, meaning intellectual and developmental disabilities, adults who have Medicaid and Medicare in the downstate areas of New York. So very, very special. And we do some things that other plans don't do in reference to supplying support and coverage for their IDD specific services such as, rehabilitation, supported employment, but also covering the full range of healthcare. So medical, vision, dental, healthcare, therapies, all of it. And so it's very unique, and members are also offered care management services that include a registered nurse and a social worker on team. So it's very, very specialized plan, non-traditional, if you will.
Mm-hmm. Now, as you mentioned, your organization focuses on, the community of people with IDD. Why are people in this community facing disparities, as we can see probably with health, but specifically with dental care?
Well, it's a great question. In general, folks with IDD are subject to being marginalized, right? And there's disparities in everything from, socioeconomic, education, and including healthcare. And so we look to sort of fill the gap where that is. We also have Partners Health Plan has a lot of diversity, equity, inclusion initiatives, and our hope is to continue to, bring forth some of these issues that are affecting our members and their families. And so specific to healthcare and dental care, we do see that by and large the population doesn't tend to go to their dental visits, and so we can talk a little bit more about what happens when that occurs. But access to care is really the issue, and so children and adults with IDD specifically attend their dental visits on an annual basis, less than the overall general population.
Yeah, I can imagine for a lot of people, sometimes people will go, maybe a year or so without visiting their dentist. So I can imagine for this community, it's maybe a little bit more challenging when you have to rely on a caregiver or someone else to kind of make that. Is that the reason why maybe it's a little bit harder?
It is. I think not a lot of people like to go to the dentist in general, right?
Right. Yeah.
Right. I don't. So I understand. But I think there's sensitivities around, first go back to access to care. The fact that there aren't many dentists or offices or clinics that specialize in serving this particular population, people with special needs. And so, for example, you have people who may have autism, and they may have sensory issues that, sight, sound, smells, the environment, familiar faces. And so I'm anxious to begin with, right, coupled with my disability. And now I'm expected to go to this dental visit, which makes me very anxious and very nervous. And so we have folks who may need just sedation for cleaning. And most dental offices don't provide that, in-office sedation for just a cleaning. And so those wellness annual types of visits people aren't going to as much because of also the doctors that specialize and support this population.
So would you say that's probably the reason why, their dental needs and experiences may differ from someone else?
Definitely. I think it's a combination of the type of disability, the range of folks with IDD, from autism to Down syndrome to head injury. You have older folks, younger folks, but definitely there's a range. And so what we want to do with Partners Health Plan is ensure that the doctors in our network, particularly the dentists, understand what our folks need so that we can best serve them and make sure that they have less anxiety when they go to the dentist and that they're going.
Right.
So, right. Mm-hmm.
Now, according to your website, studies show that people with IDDs have 30% more untreated cavities, 50% more missing teeth, and 150% more gum disease. You talked about, the lack of specialized oral care, and this is something that a lot of people, fortunately, don't have to necessarily think about. Can you talk a little bit more about that, and just how that lack of special care is actually affecting the health of people in this community?
Sure. So oral health is definitely tied to overall wellness and general health. We do have folks, for example, who have seizures, and seizure medications or medications taken to control seizures can often result in, if not treated properly, thrush, infections, tooth decay, things like that. And you mentioned having missing teeth. I mean, how can you eat properly and be safe with your nutrition? So these are very, very crucial areas of health that we want our folks to take part in. Care managers at Partners Health Plans working with families to make sure that people can have access to their dentist and monitoring. Do you need help in finding one? How's it going? Maybe a desensitization visit where I'm anxious for my appointment that's coming up in 2 weeks. And so maybe I can go for some pre-visits, visit the lobby, see some familiar faces, notice the sights and sounds, that kind of thing, and get used to it before I head there. And also, in some cases, have my family or an aide, someone to come with me, which is important.
Now, I think it's amazing that your organization is doing this work, because it's one thing to just know about it, but definitely to put that action is amazing. And on February 18th, you guys are going to be having an event coming up. Can you talk a little bit more about that?
Absolutely. So during COVID, you can imagine the general, all of us, I assume, had a hard time getting to our doctors and dentists. So, and this is something that we wanted to do. We have offered teledentistry, which can occur, believe it or not, as well for our members. But even with those, we offer free transportation to get to and from. But even with that, we still have people who have not been able to, get to their dentist or doctor. So with this mobile health unit, which is on February 18th, it's at our headquarters in the Bronx, which is on Halsey. And we're excited about it. It's our first try at this. And we've partnered with Solver Health. And what we'll be doing is a very large mobile health van, if you will be on site. And on the unit itself, there's trained staff, trained doctors who are understanding wheelchair accessible, that type of thing. And we'll be able to have appointments made for our members. And the beauty of this is going into the community. Right. So having this mobile dental unit was bringing the services to the community and to the neighborhood and to the folks who need it the most.
Now, you mentioned Solver Health. Can you talk a little bit more about how that partnership began and what that organization is all about?
Absolutely. So, yes, this is sort of a great match because Solver has a history of helping out institutions, local governments, states across the country in supporting this sort of let's bring the healthcare to the community. They've also helped out, let's say, bringing mobile dental units or mobile units to rural communities, for example. And so they have the resources, they have the experience. And so being able to partner with them with this large van to be able to get to our site and invite our members to come is it's a great match.
Now, I noticed that because of the pandemic, although it was a very, traumatic experience for so many people, things like mobile pop-ups, especially in regard to health, have been on the rise. And I think it's really cool that they're kind of here to stay. Can you just talk about the benefits of having, a medical mobile pop-up?
Sure. We actually did something similar in 2020 with COVID vaccine pop-up clinics. And we talked a little bit about dental, but imagine having anxiety or an IDD and having, a needle, someone that you're not familiar with coming at you with a needle. So same sort of thing applies. In other words, can we provide this sort of service that's specializing in the healthcare needs of the population that we're supporting and then bringing it to the community? And so it's very interesting because families, particularly in Bronx and the boroughs and in lower New York City, you have people who speak many different languages, who have very different cultures. And so that equity and that inclusiveness of saying, okay, well, you shouldn't be left out. We need to make sure that you can have access to the care that you need. And so let's do that in a sensitive way that's tailored to supporting not only Partners Health Plan members, but others. And so, that I think is why, because you can bring the service to the folks, to the people in the community.
Now, I love that you mentioned, here in the Bronx, there are so many different backgrounds. People speak so many languages. And that makes me think that sometimes that can also be another challenge, in healthcare when you speak a different language and then you do have somebody maybe that you're taking care of that may have a disability. Can you just explain, why it's so important to kind of look at the intersectionality really of something like that, especially in healthcare?
Completely agree. So again, those diversity, equity, inclusion initiatives that Partners Health Plan takes part in is really to ensure that all of our members have they have a voice, that someone's listening to them, that their care team is really, being person-centered and saying, okay, what is it that you need? So if mom is the person in their life or an aide, whoever it is, what language do they speak? What types of services can we provide to you? Do your doctors, is someone there to translate what's going on with you? Providing assessments twice a year to make sure that we are keeping up with what's going on. But again, to your point, ensuring that our network of doctors and providers out there can serve the folks that we need to, Bronx and beyond, but also ensuring that the healthcare field is listening. So that's our advocacy efforts, and our, us being a champion at large for the population is to saying to the healthcare community, doctors, hospital systems, you need to serve this population of folks and their families properly. And because if not, those wellness and preventative care issues can lead to harmful health events later.
Now, what information should caregivers have available so people with IDDs can receive this service?
Well, so for the 18th, if Partners Health Plan members out there can certainly get in touch with their care managers, and they can register for the event on the 18th. We will have more. This is our first, which is inaugural unit, which is why we're coming out to BronxNet today and Open Show to talk about it. But we will have more in the future in other boroughs, Long Island, also Rockland, Westchester. But the idea here is, and advice for those with IDD in the community, is to lean on their primary care physicians, their care managers, and the others in their life to make sure that they can connect with appropriate healthcare and doctors.
I think this is an amazing effort, and I'm so glad to hear that, things that we don't necessarily think about, people are thinking about them and providing a service. So thank you so much for joining us.
Thank you. We love what we do. Thanks very much.
Remember, this event will take place at PHP corporate headquarters located at 2500 Halsey Street in the Bronx on Saturday, February 18th. You can find out more about this event at PHP's website at www.phpcares.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and for you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at bronxnet.org. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.